Yo, Dream Team, it's your boy D Neal back with another reaction video, guys. Here we are with would universal healthcare really work in the U.S.? And we kind of talk about this. I always say, like, you know what I'm saying, after seeing these videos about Europe and the universal healthcare, you see me constantly saying we need that here in the U.S. We need that. We need that. We need that. We have to figure out how to make that work. And so now in this video, would it really work? I'm intrigued to see what, you know what I'm saying, the points they bring out in this video. But before we get into it, y'all know what I need from y'all. Hit that subscribe button, ring that notification bell, get a video a thumbs up so it gets suggested. Social media and Patreon, all up top. You subscribe to any of it, put all the links in the description. All you gotta do is hit the link, follow me, talk to me. I love talking to you guys, and I'm human. I talk back. Got a favorite video suggestion? You can subscribe to Patreon, or in the description section, there's a Google form link. What we got?
It's 3 a.m. and you're wide awake. Your stomach is on fire. It is literally the worst pain that you've ever felt. I'm talking more painful than if Iggy Azalea and Kanye West made a duet album. Because it's that.
I already know I'm gonna rock with this video, bro. Based off that alone, I know.
More painful than if Iggy Azalea and Kanye West made a duet album. Because it's that painful, you head to the emergency room. The diagnosis? Appendicitis. Doctors wheel you into the operating room, do their thing, and eventually you leave the hospital alive, minus your appendix. Modern medicine, folks. Very impressive. But that's not the end of your journey. The average cost for the surgery you just had is around $15,000. Now, if you happen to have good health insurance, that'll probably pay for most of it. But if you have bad insurance or no insurance, you're on the hook for paying most of it, or all of it yourself. Not a fun position to be in. Here in the US, we do healthcare differently than just about every other rich country on the planet. Those countries have universal healthcare, where the government guarantees that everyone has access to doctors, hospitals, and medicine without having to worry about paying thousands of dollars and potentially going broke. And that leads me to the question I'm digging into for this episode. Should the US offer universal healthcare?
I think so.
In the good old US of A, how you want to pay for healthcare is entirely up to you as long as you have the money for it. Do you smell that? That's freedom, folks. Most people choose to buy health insurance, and if you're low income or over 65, you can get it from the government. But pretty much everyone else has to buy it from companies. It kind of works like car insurance. You pay a set amount of money every month, and in return, the insurance company pays for most of your medical bills if you get sick or hurt. You're insuring yourself against the big time cost. That's basically what insurance is in a nutshell.
But the insurance be so expensive, like, and then once you do get hurt or sick, they want to bring it up, the price up, and it's like, dang, bro. But I understand where he's coming from. Know what I'm saying? Okay, so he says, you know what I'm saying? Being able to choose whether you want to pay or not, that's freedom. Oh, okay.
Against the big time cost. That's basically what insurance is in a nutshell. You can also choose not to buy health insurance and just pay doctors and hospitals directly. If you're young and healthy and never have to go to the doctor or a hospital, you're gonna save money. But you're at risk for paying a lot of money if you do have a medical emergency, like a car wreck, or you fall off your bike and break your arm. So it is a gamble.
Facts. I choose not to pay for healthcare at the moment because, like I said, I'm young and you just believe you're invincible. And you're just like, I'm out here taking chances with my life, guys. That's what I'm taking chances with my life. But yeah, I guess I do save money on
like a car wreck, or you fall off your bike and break your arm. So it is a gamble. In the US, around 91% of people have some form of health insurance, while the remaining 9% has no insurance. That's over 27 million people. For those that have insurance, the most common way to get it is through their job. The individual pays for part of the insurance and the employer pays the other part. It works great for a lot of people, but it does have a big drawback. If you lose your job, you lose your insurance. In countries with universal healthcare, they don't have this problem. Insurance isn't tied to your job, so you can't lose it. In fact, many people keep the same insurance for their entire life. Now, you've probably heard of the Affordable Care Act, aka Obamacare. In 2010, President Obama signed it into law. It required everyone to buy health insurance or pay a penalty, and it helped lower income Americans pay for it. The main goal was to increase the number of people with insurance, but it was not universal healthcare. Obamacare was really controversial. It was the biggest change to healthcare in over 50 years. Some people saved money with it and loved it. Other people had to pay more and hated it. It was a whole thing. And when Trump became president, he removed the penalty for not having insurance. That means today we remain in a healthcare system where you can choose to buy insurance or go without. Now, there are a bunch of different ways to get universal health care, and every country does it a little bit differently. In the United Kingdom, they have what people call socialized medicine. The government owns the hospitals, and the doctors and nurses are government employees. For most medical services, you don't pay anything directly. You go to the hospital, get treated, and leave. There's no bill you have to pay, and you're not paying for health insurance every month.
So beautiful.
In Canada, they have a single payer system. Doctors and hospitals are private businesses, but private insurance is rare. Instead, the government provides health insurance for everyone, and they're the single payer that then pays the hospitals and the doctors every time you have an appointment. In Switzerland, people buy private insurance from companies, but it's heavily regulated by the government, which requires everyone to have health insurance and even pays for part of it if you don't have enough money. It's kind of like a more intense version of Obamacare. Now, this may all sound great, but before you grab your protest signs and start picketing in the streets for the US to get universal health care, remember this. It has to be
Okay. He about to break it down. Yeah, it do sound great. When I be watching these videos and I hear these people getting these surgeries and you know what I'm saying, walking out for the doctors are saying no charge, or 5 euros or 10 euros, and we got an ambulance ride, you got a surgery, you got a CAT scan, you got all this stuff. And you walking out maybe paying $5 to $10. Yeah, I do be like, bro, that sound a whole lot better. Well, okay, I'm gonna let you go ahead, bring your point out, cause you about to make a point I'm sure that I don't know.
Time to start picketing in the streets for the US to get universal health care. Remember this, it has to be paid for somehow. And the way most other countries do it is through taxes. Check out this chart. People in countries with universal health care are paying more taxes than we do here in the US. That means the government is taking even more money out of your paycheck. And changing the entire healthcare system goes beyond how we pay for things. It'll affect how we access doctors and medications, and it might affect the quality of care we get. Okay, so how does the US compare to all these other countries? To answer that, we talked to T.R. Reid. He's a journalist and author who wrote The Healing of America, which looks at how healthcare works around the world.
We pay more for healthcare than any other country by a huge amount. We pay about twice as much as people in France, Germany, Britain, Sweden, Italy, Spain pay, even though they cover everybody and have better overall health statistics.
Check out these numbers.
That's crazy.
Healthcare spending per person in the US is around $10,000 per year. All the other countries with universal healthcare are spending around $5,000 per year. We're paying for the cost of 2 universal healthcare systems without getting universal healthcare. A big reason for this.
Talk to me. I don't understand
The cost of 2 universal healthcare systems without getting universal healthcare. A big reason for this is that our system isn't one system. It's a bunch of different systems. There are hundreds of health insurance companies and they all do billing differently. It's just a bunch of paperwork. These companies also spend millions on advertising and salaries for high-paid executives. The result is that almost everything costs more in the US. Remember that appendix you got removed for $15,000? In the UK, it's under $10,000. An MRI is almost $1,200 in the US, but under $600 in Switzerland. And the list goes on.
If we covered everybody with a sensible single system with the same rules and the same fees for everybody, we would cut our costs by billions of dollars. It's just much cheaper to run a coordinated system that covers everybody.
Basically, the simpler the health.
So what are we doing? If it's cheaper for the country, it's cheaper. What are we doing? So basically, you're telling me when we get hurt, we're basically paying for those high-level executives to keep getting their multi-million-dollar salaries. No, we're not paying for the hospital service because it doesn't cost the hospital that much to, you know what I'm saying, do the surgery. We're paying those you're saying we're paying those high-level executives. Is that what I'm hearing? Is that what I'm hearing? Talk to me.
To run a coordinated system that covers everybody.
Basically, the simpler the healthcare system, the more money you as a patient save, and that's what universal healthcare gives you. The US also has another unique problem. Almost 9% of our population has no insurance at all. That's 27 million people. For most of them, it's not that they're choosing not to buy it, it's that they can't afford it, and their job doesn't offer it as a benefit.
In the United States, according to the US government, 22,000 Americans, 22,000 die every year of treatable diseases because they couldn't afford to go to the doctor. That is, we could have treated that person and saved her life, but she died because she didn't have health insurance.
And when people do pay, they often struggle to come up with the money. In the US, 2 out of every 3 bankruptcies are tied to medical issues. That just doesn't happen in countries with universal healthcare. But the cost of healthcare isn't everything. We want it to be high quality, and that costs money.
Yeah.
In the US, we spend billions of dollars every year on cutting-edge research and drug development. Those companies are competing with each other to make a profit. That spurs innovation. Switching to universal healthcare could change that. You might be able to cover more people, but they may not have access to the best treatments. To discuss these trade-offs, we talked to Chris Pope, who researches healthcare policy at the Manhattan Institute, which is a conservative think tank.
I think universal healthcare is basically the idea that everyone has some sort of health insurance coverage.
Yes.
Now, what does your insurance cover is an issue that can vary enormously. Coverage can provide great access to care everywhere, or it can provide access to very limited package benefits with very high out-of-pocket costs.
Remember, 90% of Americans already have health insurance. Completely changing the entire healthcare system will be disruptive. People who have private insurance and like it might be forced to give it up. On top of that, universal healthcare means the government has a much bigger role in deciding who and what gets covered. Some care might be rationed, which means the government decides who gets what and when.
A typical thing that gets rationed would be knee surgery or hip surgery. If you need this kind of joint surgery in these countries, you might be waiting for months or the best part of a year to get access to care. Also, the most expensive
But
drug.
if you don't have the money, you'll be waiting forever. If you need knee surgery or hip surgery, if you can't afford it, which at this point so many people can't afford it, you're going to be waiting forever. You're never going to be able to get it. You feel me? And so, does it hurt worse to wait months to get it? But then you're not really charged for it? You feel me? That's just my thinking, but I guess if you can afford good private health insurance, if you have money, then I guess universal health care wouldn't work in your benefit. I would think it's more for the people who struggle to pay for health insurance or who just can't afford health insurance. And I think that's a ton of people in the U.S., which is why I think to cover people as a whole, universal health care, I believe would be the best option. But if you have money, I can understand why you wouldn't want it.
For months or the best part of a year to get access to care. Also, the most expensive drugs. There are a lot of new cancer drugs that are available in the United States. In Britain and Canada, these aren't going to be available necessarily to so much of the population.
Instead of bringing the government into healthcare, why not take employers out of it? Remember, most Americans get insurance through their jobs. It doesn't have to be that way.
I think the big opportunity for change and improvement in American healthcare is really to let individuals buy health insurance on the same terms that employers can. If it was an individual that controlled the insurance, it would be your insurance. You would own it, and you would have a right to renew it as you move from job to job.
Oh, hey there. Thanks for making it to the end of the video. We know that was a lot of information that we threw at you. So just to make sure that we're all on the same page, I thought it'd be cool if we did a quick little recap just to make sure that we all understand universal healthcare. So the pros for it are that everyone would have access to it. It wouldn't be tied directly to your job, and going to the doctor, to the hospital will cost a lot less money. Now, the arguments against it are that your taxes may have to go up to pay for it. The quality of care may not be the same. And with more government control, the individual has less choice. So, do you think that America should keep doing healthcare the same way? Should we switch to a universal healthcare system, or should we do something different entirely? Now, this is a big issue in the elections because, eventually everybody's gonna have to go to the doctor. And as always, leave us a comment below. Oh, I forgot. If you like this video, check out our other video, Universal, in the title, all about universal basic income. When you watch it, it'll all make sense. I promise. They connect. I swear they do. I'm your host, Miles Best. Till next time. Peace.
Shout out Miles Best, man. What do y'all think? I've always thought universal healthcare is the system that we got, but I never thought something completely different. If I had to think outside the box, I couldn't imagine what a completely different system would look like. Personally, I think universal healthcare, but I do see the cons, and I see why certain people wouldn't want universal healthcare. But I just think it covers everybody as a whole. It allows everybody to have access, which I think is the most important thing to me, is that everybody has access, and 22,000 people a year aren't dying from treatable diseases, treatable things. And so that's all we got for this one. You guys got a favorite video? Anything you want to see him react to, you can subscribe to Patreon, or in the description section there's a Google form link. Hit the link, fill out your suggestions, send it to me. Want me to get to yours faster than others, fill out premium. Make sure you hit subscribe to the channel, ring notification bell, give the video a thumbs up so it gets suggested. Social media, Patreon, all up top. You want to subscribe to any of it, put all the links in the description. All you gotta do is hit the link, follow me, talk to me. Love talking to you guys. You guys are the most incredible team on YouTube. It's your boy D Neal. Out.